Locked-in syndrome is a rare but very serious neurological disorder in where the patient cannot move their limbs, cannot speak, or perform other ordinary tasks on their own. However, the patient usually retains full consciousness and can communicate with others through blinking and moving their eyes. Locked-in syndrome is most often caused by damage to the brainstem, this area in particular being the pons. The pons is responsible for linking your brainstem to the spinal cord and allows signals to travel between the brain and the body. The pons also plays a role in perceiving pain. Due to this, some locked-in syndrome patients may not feel pain. Damage to the pons can be caused due to various reasons such as stroke, head trauma, and less commonly, infections. Since the causes of locked-in syndrome are quite broad, anybody can get it. However, it is more common in people between 30 and 50. Locked-in syndrome is usually misdiagnosed in the beginning, as the patient presents as being in a coma before their recognition of consciousness. Patients suffering with locked-in syndrome have a complete loss of motor functions such as speaking, walking, writing, and making facial expressions. This is due to their body's paralysis below the eyes. All patients with locked-in syndrome can hear, comprehend what people have said, think and reason like normal, and have sleep and wake cycles. However, complications from being immobile can cause symptoms such as pneumonia and bed sores if the patient is not properly taken care of. To diagnose locked-in syndrome, healthcare providers will use a series of tests to help diagnose the syndrome, as well as determine the cause and rule out any other conditions. A few examples of these tests are an MRI scan, which can show the damage to the pons and other areas of the brain, a cerebral angiography, which can show any blood clots in the arteries of the brainstem, and a lumbar puncture to examine any infections. Unfortunately, there is no cure against locked-in syndrome, and a full recovery from locked-in syndrome is highly unlikely. Due to medical complications related to locked-in syndrome, some patients do not live past the early stage. Fortunately, however, slight motor function recovery is possible through the use of therapies. There are also treatments and other therapies to help patients with locked-in syndrome. Speech therapy, for example, is used to help patients communicate by blinking and through eye movements. For example, looking up could mean yes, and looking down could mean no. Although locked-in syndrome is a very severe condition, many patients still go on to live full and meaningful lives through the support from the healthcare providers and loved ones. Many patients also go on to live for another 10 to 20 years after the condition was diagnosed.